We continue with the large intestine channel, sinew channel. Pathway, the large intestine sinew channel begins on the index finger at LI1, runs along the index finger and the second metacarpal bone towards the wrist, where it binds at LI5, travels along the posterolateral aspect of the forearm, reaches the elbow and binds at LI11, continues along the lateral aspect of the upper arm and the deltoid muscle to the shoulder, where it binds again at LI15. From LI15, a branch spreads across the scapula, then attaches to the spine between the 7th cervical vertebra and the 5th thoracic vertebra, or between Do14 and Do11. The main branch ascends from LI15, crosses the supraclavicular fossa, and continues from there along the lateral aspect of the neck towards the angle of the jaw, where it binds. Here it forks into two branches. One branch runs across the zygomatic bone towards the lateral side of the nose. The other branch ascends the lateral aspect of the face and anterior to the small intestine sinus channel, connects at GB13 with the other sinew-yang channels, crosses over the head and ends at the lower jaw on the opposite side. Note, according to some schools of thought, the sinew channels only ends at LI17. Clinical importance, pathology, cramps, pain, tension, stiffness along the large intestine sinew channel, limited range of motion of the upper limbs and shoulders, occipital pain, stiffness, and limited range of motion. Indication mainly for B syndrome, painful obstruction syndrome along the large intestine channel. The area covered by the large intestine sinew channel is larger than that covered by the large intestine primary channel. This explains why the indication of points of the large intestine primary channel include disorders and diseases of the upper neck, thoracic region, as well as of the whole face, for example, frontal and temporal headaches. The large intestine sinew channel begins at the tip of the index finger at Xiaoyang, LI1, and binds at the dorsum of the wrist, ascends at the forearm, and binds at the lateral aspect of the elbow, ascends the upper arm to bind at the shoulder. A branch winds around the scapula and attaches to the upper thoracic spine. From the shoulder, the main channel ascends to the neck, from where a branch ascends across the cheeks to bind the side of the nose, while the main channel ascends to the anterior to the small intestine sinew channel, crosses the temple to the corner of the forehead, and crosses over the top of the head to connect with the mandible of the opposite side. Pathological symptoms of the large intestine sinew channel: cramping and pain along the course of the channel, inability to raise the shoulder, inability to turn the neck to the left or to the right. So we have here the large intestine sinus channel, crosses over the top of the head to connect with the opposite mandible, binds at the side of the nose. It attaches to the upper thoracic spine. So this one begins at the tip of the index finger at LI1.